Welcome back. You're watching Checkpoint. Now, an alarm has been raised over increased cases of kidney illnesses and breast cancer in Kwale County, with health practitioners calling on Kenyans to go for early tests and change their lifestyles. Msambweni Referral Hospital, which has also been partly serving patients from Likoni in Mombasa, Kilifi and also Tana River, is currently treating 12 people per day at its renal unit. On breast cancer, the Cabinet Secretary for Health, Susan Nakhumicha, says the counties are number 28 out of 47 and says this number could rise if early tests will not be done. Tobis Chanje reports on the fate of patients and what the county government is doing to address the disease burden.
This is Mwanatumu Sulaiman from Likoni, Mombasa. She has kidney complications and has come to Msambweni Referral for renal dialysis services.
Mimi ninakuja Msambweni kwa dialysis. Wakati ilipokuwa yanianza mimi sijui ilikuwaje, niliumwa na tumbo tu peke yake, alafu ndio nikakuta sina fahamu mpaka dakika hii ndo na shughulika na hiyo dialysis.
Alongside her is Mwalimu Waziri from Vanga, who has come for a similar treatment. They both come here twice a week.
Ugonjwa huu sikueleza tafadhali. Kwa sababu nilikuja Ngalazo hapa, Kadara. Kwa madaktari akaniambia lazima kupimwe. Kupimwa kwa bwana. Tabidu wanasafiri wa pigo. Ndio kwa mbaya. Kubali.
There are two types of patients who come here, those with acute and those with chronic diseases. According to Dr. Hassan Mwachome, there has been rampant cases of kidney diseases because of prostate cancer and diabetes.
Kwa siku hapa ideal tuko na wagonjwa kama around 12 per day. Na tunafanya Monday mpaka Saturday.
And one of the reasons why we have so many cases, especially for the elderly age, one of the reasons is because of these issues of diabetes and hypertension. And another case is the issues of the prostate. And as we know, prostate is one of the major diseases of the elderly, especially the men. And that's why we are having these rampant cases of dialysis, because now they get into what we call end-stage renal disease, where the kidneys are not functioning. So the dialysis mainly is helping the kidneys do their function.
He adds that they are now rampant because of treatment services. From the hospital records, there were 120 cases for Kwale in 2021, which rose to 174 in 2022, then 694 in 2023. This year, they are receiving 12 cases per day.
The issue why we see them rampant is because of awareness. Because maybe before there were no services, so we could not meet these patients. But now, because patients know there are services, so this patient now is like they are aware of the services, so we see them because they come for the services.
Sababu hospitali ya Msambweni ndio hospitali kubwa ambayo kila Mkwale anategemea kuwa ndio hospitali ya mwisho ya kutibu yale ambayo atakuwa yameshindikana katika zile hospitali zingine.
At the renal dialysis unit facility, there is a reverse osmosis plant to solely purify water by changing it from salty to fresh. The fresh water is not only used at the renal unit, but also at the oncology unit to treat the increasing number of cancer patients, according to Cabinet Secretary for Health, Susan Nakhumicha.
It would mean we are spending nearly 60,000 per week on water supply for the renal system. Now the county has invested on a reverse osmosis plant, which has costed 5 million and above, and it purifies the water so that now we can use our own water in the hospital to service the renal system. So it has reduced our cost, by 60,000 per week.
Reverse osmosis plant ili hospitali yetu ya Msambweni iweze kupata maji safi na salama bila ya mhangaiko. Tumekuwa tukileta maji ya dialysis kutumia water boozers, lakini leo hii ugonjwa ule tumeumaliza. Uko ngopata dawa.
Saratani ni mingi sana. Haswa hapa Kwale tuko na shida ya breast cancer. Iko kwa wingi. Nchi mzima Kwale ni number 28 out of 47. Kwa hivyo kuna haja ya kwamba kina mama na wazee mkaeze kwenda kupimwa mapema.
And if patients will need oxygen services, 2 oxygen facilities are in operation. The pressure swing absorbent plant that compresses air from atmosphere and liquid oxygen tank. With 405 gas cylinders, the oxygen is supplied to other hospitals in Lunga Lunga, Kwale Town, Kinango and Samburu.
So there's a compressor that receives oxygen from the atmosphere, compresses it, purifies it, cools it, and then it is taken now to the main plant where the components of oxygen are separated from an element called zeolite. The zeolite will only allow the elements of oxygen and removes other gases as impurities.
Recently, Nakhumicha led 2 other cabinet secretaries launching and commissioning some of the projects in a move that Kwale Governor Fatuma Achani says will assist in treating kidney and cancer illnesses.
Kile kituo cha kutibu ama oncology center iko pale Kwale Hospital na imekamilika. Tayari imeanza kufanya kazi.
Tumefungua liquid oxygen plant. Na hiyo tumefanya kwa collaboration national government na county government.
So I want to confirm, Governor Kwamba, we will work on these programs of accelerating electrification of the facilities, public facilities. Na hiyo ikifanyika tunafanya early maximization ili kwamba watu wanaishi karibu pia wafaidike.
Na kwa sababu hiyo Mheshimiwa Rais ameweza kutuma sisi mawaziri wake hapa 3 kwa kaunti hii kwa safari moja. Hiyo ni kwa sababu ya ushirikiano.
Ikiwa umepimwa na umepatikana uko na huu ugonjwa, wewe utabenefit kutoka kwa hiyo chronic, emergency na critical illness fund.
Tobias Chanji, KTN News, Kwale County.
Coming up in the world of